today in central London. She is striking. Dr. Waller, thank you so much for talking to us. Let's start. You've been a junior doc for 3 years now, have you not?
That's correct, yeah.
So what was it like when you first started?
I started during the pandemic, and I was graduated early to work during the pandemic, so I didn't really have a frame of reference. It wasn't what I expected, to say the least, but we all pulled together, and there was a real sense of camaraderie and kind of everyone pitching in and trying to do the best that we could under extraordinary circumstances. Since then, I haven't really seen that pressure let up, and I think that's why so many junior doctors are so disillusioned and so burnt out. It's not just been COVID, it's been far bigger and more kind of systemic problems than the issues that we faced during COVID that we're striking about now.
Is that how you feel? Do you feel burnt out?
I am absolutely burnt out. I should be in training, so I should be on a training pathway, training towards a particular specialty, and this year I'm doing what's called the Locum year, so I'm just working ad hoc shifts, which costs the NHS a lot more per hour than if I were a trainee, but as we've seen, the hourly rate for trainees is abysmal. For a first-year doctor, it's £14 an hour, and that only goes up to about £28 an hour for a doctor that's been working for 8 or 10 years.
The term junior doctor, it's a bit misleading, isn't it? Because there's nothing really junior about what you do.
It is very misleading. Even as a first-year doctor, when I was on call, so in the evenings or weekends or nights, I would be the only doctor looking after sometimes up to 3 wards of patients, and I could be the first doctor on scene if a patient's heart stopped beating or they became very unwell. So junior, I think, is misleading because it implies that we aren't qualified professionals and that maybe we don't know what we're doing, but we very much do know what we're doing. We very much know what we're doing, and what we're trying to say is that we also know our worth.
So as a locum, for people who don't know, what does that look like to you? What does a shift look like to you? What does a week look like to you?
So it's the exact same work, and that's what can be so silly about the system. I'm doing the exact same job, but because I'm filling a gap in the rota, I'm filling a shift that would otherwise go empty, I'm being paid much more for it. This costs the trust and the NHS a lot of money, but because they haven't invested in long-term solutions and staff retention, they're putting a short-term band-aid on the problem. So I'm doing the same work that I would have been doing as a trainee, but because I'm filling a need, I'm getting paid more.
Okay, so what do you say to the health secretary and NHS officials saying you are actively putting people's lives at risk with this 4-day walkout?
I think it's very frustrating to hear that, because what we have been saying, so what junior doctors and the BMA have been saying for months and months, is that it's the government that has been putting patient lives at risk and patient safety at risk by not investing in the NHS and lately refusing to engage with our union and come to the table to negotiate.
Okay, well, they say they're ready to talk, but it's this figure of 35%. Would you accept lower than 35%, or do you strongly believe that, no, we need 35%, and it's the government who needs to come to the table and accept that?
So I think it would be up to our union representatives and the government to discuss the numbers, and then they would propose a solution to members who would then vote on it. Personally, I think 35%, if it sounds like a lot, it's because our pay has been cut by a lot. And we are working highly skilled professionals in a free market economy. So what I'm seeing is a lot of colleagues are choosing to go places where they are being paid in a way that they feel reflects their worth.
Is that something?
Go ahead.
Is that something that you'd consider, leaving and going more? You went to medical school in the UK, didn't you?
I did, yeah. I went to medical school in Wales. It is something I have considered. I'm looking at a variety of options. I've looked at leaving the NHS altogether. I have friends who've gone into things like management consulting. I've looked at working abroad. I've got plan A, B, C, and D at the moment because looking to a future of the NHS as it stands is no future at all.
Now, the BMA have said that it's more than about pay, it's about patient safety. So can you, through your work, do you have an example where you have seen firsthand where a patient's life has been put at risk?
I see examples in almost every shift. I see examples of patients waiting a very long time to be seen by a doctor in shifts that I work in A&E. I sometimes do general medical shifts. I've done general surgical shifts. I've worked in a variety of contexts in the NHS as a trainee and as a locum, and there hasn't been a single shift in my 3 years of being a doctor where I haven't seen examples of patient safety being compromised. And none of that is down to the 4-day strike that we're currently facing. This is, as I said, this is the result of a very long attrition of investment funding and staffing of the NHS.
Okay. Dr. Waller, thank you so much for talking to us.
Thank you.